Definition of nursing process. A process is a series of steps or acts that lead to accomplishment of some goal or purpose. Purposes of nursing process. 1. Providing professional quality nursing care. 2. Directs nursing activities for health promotion, health protection, and disease prevention, and is used by nurses in every practice setting and specialty. 3. Provides the basis for critical thinking in nursing. Phases of the nursing process. 1. Assessment of patient's needs. 2. Diagnosis of human response needs that nurses can deal with. 3. Planning of patient's care. 4. Implementation of care. 5. Evaluation of the implemented care. 1. Assessment is the first step in the nursing process and includes systemic collection, verification, organization, interpretation, analysis, and documentation of data. The completeness and correctness of the information obtained during assessment are directly related to the accuracy of the steps that follow. Assessment involves several steps: A. Data collection from a variety of sources. B. Data validation. C. Organizing the data. D. Data interpretation, data analysis. E. Making initial inferences or impressions. F. Recording or reporting data. Or purpose of assessment. 1. Organize a database regarding a client physical, psychological, and emotional health. 2. Identified of health-promoting behaviors and actual or potential health problems. 3. The nurse can ascertain of the clients about A. Functional abilities. B. Absence or the presence of dysfunction. C. Normal activities of daily living. And D. Lifestyle pattern. 4. Identifying the client's strengths gives the nurse information about the abilities, behavior, and skills the client can use during the treatment and recovery process. 5. Provides an opportunity to form a therapeutic interpersonal relationship with clients. 6. The client can discuss healthcare concerns and goals with the nurse. Type of assessment. The information needed for assessment is usually determined by health care setting and needs of the clients. 3 types of assessment includes: 1. Comprehensive assessment. Provide baseline of client data, including a complete health history and current needs assessment. B. Usually completed upon admission to healthcare agency. C. Changes in the client's health status can be measured against this database. D. Includes of client's physical and psychological health, perception of health, presence of health risk factors, and coping patterns. 2. Focused assessment. A. Is limited to potential health care risks, a particular need, or health care concern. B. There are not as detailed as comprehensive assessment. C. Often used when short stays are anticipated, for example, outpatient surgery and emergency departments. D. Used in specialty areas, such as mental health settings and delivery. E. Used in screening for specific problems or risk factors. 3. Ongoing assessment. A follow-up or monitoring of specific problems. B. Broadens the database and allow the nurse to confirm the validity of data obtained during the initial assessment. C. Systematic monitoring allows the nurse to determine the client's response to nursing interventions and to identify any other problems. Sources of data collection by assessment methods. A. Primary sources. The client should be considered the primary source of data. As much information as possible should be gathered from the client, using both interview techniques and physical examination skills. B. Secondary sources. Data sourced from other than the client are considered secondary sources, family members, other healthcare providers, and medical records. Types of data collection by assessment methods. A. Subjective data, also called symptoms, are data from the client's point of view, provided verbally by the patient, and include feelings, perceptions, and concerns. Interview is the primarily method of collecting subjective information. Steps of collecting subjective data. 1. Begin with a patient's main concern, chief complaint. 2. Reason of seeking health care. The question, What happened that made you decide to come to the hospital, clinic, office? 3. Use the letters of the what's up questioning format to remember. Questions to ask the patient. See Table 1 Guide to Symptom Assessment. 4. Obtain a patient history by asking the patient and family questions about patient's past and present health problems, including specific questions about each body system, family health problems, and risk factors for health problems. The patient's medical record may also be consulted for background history information. Examples of subjective information. I have had pains in my legs for 3 days ago. B. I have had headache, nausea, vomiting, dizziness for 3 hours ago. C. I have had anxiety from surgery. B. Objective data, also called signs, are observable and measurable data that are obtained through both physical examination and the result of laboratory and diagnostic tests. The primary method of collecting objective information is the physical examination, which provides information about the function of body systems. Inspection, palpation, percussion, and auscultation techniques are used to collect objective data. Examples of objective information include a temperature 37.3 degrees Celsius, pulse rate 100 bm, respiration 18 tm, blood pressure 130/76 mm/Hg, B positive bowel sounds, Z flushed face. Validating the data. Objective information may add to or validate subjective information. Validation is a critical step in data collection to avoid omissions, prevent misunderstandings, and avoid incorrect inferences and conclusions. Organizing the data. Data that are collected must be organized to be useful to the healthcare professional collecting the data as well as others involved with the client's care. Data should be organized through a data clustering, admission assessment format is the process to putting the data together in order to identify areas of the client problems and strengths. B. Assessment model is a framework providing a systematic way to organize data such as 1. Hierarchy of needs proposes that an individual basic needs, physiological, must be met before higher level can be met. 2. Body system model organizes data according to tissue and organ function in the various body systems. 3. Functional health pattern cluster information about client habitual pattern and any change to determine if the client's current response is functional or dysfunctional. 4. Theory of self-care based on the client ability to meet self-care needs and identifying existing self-care deficits. Interpreting the data. When data are placed in clusters, the nurse can distinguish between relevant and irrelevant data. B. Determine whether and where there are gaps in the data. C. Identify patterns of cause and effect. Documenting the data. Assessment data must be recorded and reported. The nurse must make a judgment about which data are to be reported immediately and which data need only to be recorded at that time. Data that reflect a significant deviation from the normal, for example, rapid heart rate with irregular rhythm, severe difficulty in breathing, or high levels of anxiety, would need to be reported as well as recorded. Examples of data that need only to be recorded at the time include a report that prescribed medication has relieved a headache and a determination that an abdominal dressing is dry and intact. Note, assessment does not end with the initial interview and physical 32 examination. Assessment is dynamic and continues with each nurse client 33 interaction.